So, hey, everybody, afternoon. It's great to see you. I'm Carrie Chapman. I work for a legal aid organization called the Legal Council for Health Justice, and I use she, her pronouns. And we're a small legal aid organization that provides direct services and also does policy and impact work on Medicaid. And I'm here with two of my greatest collaborators and Medicaid champions, Stephanie Altman and Nadeen Israel. So it's been very fun to talk about what's going well. And we do celebrate our victories here for sure and appreciate our state Medicaid agency for all the things that they've done that are working. But there are definitely some challenges. So going in different order, Nadeen, what are some of the challenges that we're seeing here?
Yeah, I would say a couple. So looking at again, it's about 1 month's worth of data right now. So keeping that context for Illinois in mind, looking at our wait time and our drop time percentages for call center. While it's not horrible, it's definitely been worse in Illinois before, and we know that. It's depending on kind of what report you look at. I saw, anywhere from 10 to 14 minutes of wait time. And a drop rate between like an call abandonment rate of 28 to 34%. So just while it's, like I said, it's been worse, that's still too long for somebody to wait. And that abandonment rate is kind of, I think, showing that. So that's one area where we're looking at to see, and staying in contact with the state to see what else can be done to improve that piece. Yeah, the maybe I'll hold off on the opportunity for the reading part.
Yeah, let's close maybe with opportunities.
Sounds good.
So, Stephanie, what's another challenge?
Yeah, I think another challenge that we've really seen is these system outages. So our electronic system is called for people to manage their own benefits and be able to do their redeterminations online. Already had some barriers just to be able to set up an online case, so not everyone can. And we certainly reported lots and lots, all of us, over the years of issues with people who couldn't go through the identity proofing, which was quite difficult. So if you're an immigrant or you don't have a strong credit history, adult, disabled child, or homeless, in particular, it can be very difficult to even set up an online case. Based on all the stories that we've sent to the state on that, they did make a new improvement this year that has helped a lot of people be able to set up an online case, which allows ID proofing through the Secretary of State. So that is one good win that we've been able to get, but there are still a lot of people who can't set up cases. For people who can set up an online case, and that's over 2 million people in Illinois, it's the best way by far to renew your benefits because there's a renewal button. You don't have to worry about the mail. You don't have to, other than ex parte, where you don't have to do anything at all. This is the next best way if you do have to provide information. But the system was down a lot. And just as the public health unwinding was happening in May, we were seeing the system really feel the effects of that strain of people. And it was often down just when people needed to get in. So weekends and nights, the state was required to had to basically take the system down to try to fix things. And that's often the time when our clients can even, deal with this kind of thing because they're working lots of hours and really may need to access these systems after hours, as we all do. So it really was a perfect storm. And we were getting a lot of reports, both from clients and navigators, that the system was down over and over again. And even some people could not complete their redetermination up to the very time that they had to. So as we reported that to state, the state took some quick Band-Aid urgent, emergency measures and said people could call in, and do their ready, but you already heard about some of the call line problems. So the minute that the federal government allowed the states to maybe pause terminations and to give them a little more time, Illinois, partly on the basis of all the, stories that we had put forward to them, took advantage of that. And they did delay terminations, which is why we only have about a month of data. They didn't terminate anyone until August 1st. from the June redetermination dates, and they took the opportunity to extend that grace period all the way into the future. So for 1 month, all the way into 2024. So while the system problems are still not worked out and they're working on them, we're really glad that they kind of listened to our stories and were able to take some quick moves, at least to ameliorate the impact.
And I would just say, I think one of the interesting situations we have is with notices. So on the one hand, actually, the state did make some changes to make the most important information on the front page of the notice and to put things in slightly plainer language. But what we're seeing and hearing stories from folks about are notices about the more complicated Medicaid programs, so Medicaid spend down, Medicare savings programs. And we're seeing those notices are pretty much a mess. They're kind of unreadable. Page 1 seems to contradict page 3. And these are already programs that are really difficult to understand. So it's really important to get a clear notice. We're also seeing cases that are improperly processed behind the scenes. So that's certainly an issue too. But one of the most important things that we want to continue to work on is just making sure that those notices are clear so that when people get them, they know what to do. Because oftentimes there's a small window to act before you're in a coverage gap, and folks on spend down are generally older adults and people with disabilities. They have high need for regular medical touches, and having any kind of coverage gap is really problematic for them. We're also seeing, I think it's just sort of you bring your best self and your worst self to the crisis moment. So for example, we struggled in Illinois with mailroom delays. So we would get backed up mail in the mailroom. So your notice would have one date, and then the postmark, if there was a postmark on the envelope, might be 4 weeks or 6 weeks later. And obviously all the information was stale by the time that you got it. And so we are starting to see mailroom delays again. So we're getting notices where there's a postmark 4 weeks after the notice generation date. And obviously that's really a problem for folks. So that's something that we're continuing to advocate on and work on because we just have countless stories of folks who are like, I don't know what to do because all of the things I was supposed to do were supposed to be done by a date before this even got postmarked. And so that's something we continue to need to work on.